Moving on to your cardiovascular assessment. So in order to do that, I'm just going to listen to your heart. And again, when I took her heart rate the first time, she had a normal rhythm. Nothing was wrong with that when I took her vitals. So if you could just take a deep breath in and out for me. First, I'm going to listen to your aortic. Good. And then your mitral. No. Excuse me. Your pulmonic. Good. And your tricuspid. And lastly, your mitral. I'm just going to switch up your shirt. Very good. So her heart sounds are very clear, very normal, no murmurs. And now I'm just going to listen with the bell of my stethoscope. And just listen to the tricuspid and mitral valves. Perfect. So again, that was listening for S3 and S4. No murmurs or nothing was wrong with that. Now I'm just going to be testing your dorsalis pedis pulse and your posterior tibial pulse. So if you could just lay all the way back for me. So first I'm going to test your dorsalis pedis pulse. Awesome. Cool. So they were a 2 out of 3 on both sides, which is very good. And onto her posterior. I'm just going to go on the inside of the ankle here. And just go the foot. Good. Again, a 2 out of 3, equal on both sides. So that looked really good. Next, I'm just going to move on to your skin. So if you could just sit up for me again. Perfect. So first I'm going to assess the color of your skin. She's clearly Caucasian, so she's fair, pale, which is all very normal finding. Next I'm going to do sensation. So I'm just going to have you close your eyes. I'm just going to poke you on a part of your body. You could just tell me what part of your body that is.
Arm.
Which arm?
Oh, right arm.
There you go.
Left arm. Left leg. Right leg. Tummy. Chest. Neck. Forehead.
Perfect. All right, so sensation was clearly very good. So color and sensation were good. Movement, I'm just going to have you wiggle your toes for me. And roll your ankles. Wiggle your fingers. Roll them out. Your wrists. Perfect. So clearly her movement is also very good. So this is a good finding. And there's no edema. Nothing was wrong. She looks good. Next, I'm going to move on to her pulmonary assessment. So I'm just going to start by saying her respiratory rates were within normal limits. It was a 14, and she's clearly not in any sign of respiratory distress and has no labored breathing or any difficulties with that. So first I'm going to auscultate you anteriorly. So if you could just take deep breaths in and out. So I'm going to start by doing your right apex. Breathe in. Oh, actually, I'm going to switch back. All right, breathe in. All right, left apex. Good. Left upper. Right upper. Left upper. Right upper. Good. Now I'm just going to do you laterally. So I'm just going to have you face the wall this way. So I'm doing her right side. So I'm just going to have you lift your arm above your head. Perfect. So I'm going to do right upper. Right middle. And right lower. Good. And can you just do the same thing on the other side? Left upper. Left upper. And left lower. Good. Okay, I'm going to do her posteriorly, but before I do that, I'm just going to say that all of her breath sounds were clear to auscultation, and there was no adventitious breath sounds, and it was bilaterally, so she had no problem. There was symmetrical on both sides. So I just want to say that before I do posteriorly. Okay, posteriorly, I'm going to do left upper, right upper, right lower, Left lower. Right lower. Right lower. And then left lower. Right lower. And left lower. Good. Again, no clear auscultation, no adventitious breath signs, and these findings were bilaterally. So next, I'm just going to assess your abdomen, or your abdomen. So if you could just lay back for me, I'm going to ask you a few questions before we get started. So, are you having any trouble passing gas?
No.
Have you had any recent bowel movements?
Yeah.
Okay. And was this soft and formed, your bowel movement?
Yeah.
Yep. Okay. And then, are you having any problems with nausea or vomiting?
Nope.
Okay, perfect. So I'm just going to assess your abdomen. So the abdomen is split into 4. So I'm going to listen first for your bowel sounds. So this is your right upper quadrant. Your left upper quadrant. Your right lower quadrant. And left lower quadrant. Sorry. Perfect. Okay, so she had active bowel sounds. There's nothing wrong with that. They were not hyper or hypo, which is all good. And now I'm just going to palpate your abdomen in the 4 spots again. She's really ticklish, so she might laugh, but I'm going to try my best. Okay, I'm just I'm not even going to press. I'm going to pretend like I'm pressing. No, I'm going to press. I'm sorry. Okay, good. I'm sorry. Okay, perfect. Okay, so her stomach was non-tender, non-distended, but soft. That was all very good. You can sit up for me again.
Listen to your lungs really quick. So when I put this on your chest, just take a nice deep breath for me.
Inspection, I looked before, there's no edema, no issue here.
Bronchial.
Less than 3 seconds, no signs of
Bronchovesicular.
no excess sweating, skin is pink and
Vesicular lung sounds. Okay, we're going to down this back too.
bronchial, vesicular, and vesicular.
Normal lung sounds heard throughout, no adventitious sounds, no crackles, wheezing, or anything like that. Your breathing pattern is even and regular. So can you sit up nice and straight for me and take a nice deep breath? Good. So excursion is symmetrical. And I'm going to put my hands on your chest, just say 99.
99, 99, 99, 99,
Okay. And on the back.
99, 99, 99, 99.
Okay. Tactile firmness is equal bilaterally. I'm going to do some percussion on your chest.
Like, I got all this, heart sounds, but at all points, no murmurs, no heart attacks. Vesicular and heart palpitations, heart flutters. These are your temple pulses.
Okay. Resonance heard in all fields. Do you have any shortness of breath, difficulty breathing anytime? We need to do cardiac now, so just gonna listen to your heart really quick. Mind laying down for me, actually?
Pulses are even.
Your aortic.
Like I said, it's saying good night. Inspection, you said you don't have any trouble chewing or swallowing? No. Any indigestion? Nope. Changes in diet or fluid intake?
Point.
Any unintentional
S1 and S2 sounds were heard. No abnormal sounds were noted. I'm just gonna feel your pulses now.
Wait,
This is
could you
your
hear that one?
temporal
I could really hear that one.
Man, what is up with
carotid
me?
pulse. Your apical pulse.
Vowel sounds are active, maybe a little bit hyperactive.
Oh, sorry, yeah.
Alright, I'm gonna percuss your abdomen now.
Your brachial pulse. Your radial pulse.
Yeah, but this one should sound different. It does.
Femoral. I'm sorry, popliteal.
I don't know. Is there anyway? That's cool. Your spleen.
Posterior tibial.
Any pain there? Her kidney over the all organs, stomach, and dullness over the solid organs.
Dorsalis pedis. Okay. All pulses were felt 2+. Next is the abdominal assessment. So I'm just gonna lift your shirt up if that's okay. Upon inspection, the abdomen is nice and flat. I don't see any masses
Burning on urination.
or bumps or anything like that. I'm just gonna take a listen.
Go ahead and stand for me. I'm going to assess your spine. Bend over. Curvatures within the normal limits. Can you stand on one leg for me? And the other one. Can you bend out? And those are the other one. Stick your arms out in circles, and can you stick them up and back and forward? Right, range of motion is good. We talked about muscle tone and strength earlier. Balance is good.
Normal active bowel sounds.
Yeah, you can sit back down. Do you have any
I'm gonna do
tingling
some
pins and needles?
testing now.
History of falls?
I actually fell from last week. So I had socks on. And I was like trying to be like funny, and I was like dramatically running
Tympany and
across the
dullness
pool.
heard.
But the socks were like
And I'm just
slippery.
gonna palpate so you don't feel any pain or
I like
tenderness.
legit fell. And I was just laughing so hard. But no history of falls.
You should wear socks with grips on the bottom if you're gonna slide on socks in the kitchen.
No bladder distension.
Anyway,
Okay.
history of falls.
And have you had any indigestion? Any trouble chewing or swallowing?
No.
Any changes in diet or fluid intake?
No.
Have you had any weight changes? Any diarrhea or constipation? If you'll sit back up for me, we'll do the musculoskeletal assessment.